Hello, my name is Sylvia Ofori. I'm a third-year doctoral student of epidemiology, and I'll be talking about the public health interventions and time-varying reproduction number of COVID-19 in Ghana. These are the authors for this project. So in Ghana, over 67,000 cases of COVID-19 were reported as of January 30th, 2021. And when the pandemic hit in March, various interventions were implemented in the country. But I realized that with time, compliance to these interventions reduced. And so there's the need to assess the effectiveness of interventions, to know which ones to prioritize on, and to see if there's a need to strengthen ongoing measures. So the aim of this project was to assess the impact of the different interventions against COVID-19 using the time-varying reproduction number. The time-varying reproduction number is an epidemiologic parameter which is used to assess how infectious diseases are being transmitted, like the rate at which it grows. So if you get a value of less than 1, it means that the epidemic is slowing down. And if it's greater than 1, it means that the epidemic continues to grow. So this is the map of Ghana, which is the study site for this study. And looking at this map, you can see that there seems to be a disparity in how cases of COVID-19 are distributed across the 16 regions of the country. In this study, I used data from the Ghana Health Service website, and the data collected includes the date of reported data, cumulative incidence, and the number of new infections for each region. And the time frame generally ranges from March 12th to January 30th. And also, since I use the dates of reported data, I try to assume the date of infection by shifting the data by 9 days. I'll be using a method developed by Corey et al., that's the instantaneous reproduction number method, to estimate the time-varying reproduction number, which is also known as the RT. So this method is used because it can be calculated easily in real time, and you can take into account control measures that have been implemented. So 2 sub-methods are being used. I'll use the 7-day sliding windows method, which assumes that the RT is constant between each 7-day period. And to find out how the interventions affected the RT, I'll use the non-overlapping windows method. Also, if you remember the map I showed previously, we saw the disparity. So I try to analyze the relationship between the cumulative case number and population size using the power law method. And for this, we use the slope of a regression line between the log transformed variables. And if you get a slope of 0, it means that means that there's no difference in the per capita cumulative incidence across regions. So for the first part of my results, I'm showing a table of interventions that have been implemented and the dates that they were implemented. So these labels are what you will see on a graph that I'm about to show next, and that will just give you an idea of what intervention was implemented. So here I have a result for 5 regions in Ghana as a whole. So the left panel is the epidemic curve, middle panel is the RT using the 7-day sliding window, and the right panel it's for the non-overlapping methods. So if you look at the plots for each, if you look at the RT plots for each region in Ghana, you can see that there was a lot of fluctuations around 1, which shows that there are times that the epidemic slowed down, and also there are times that it slowed down and other times too it grew. And if you look at the right panel, you can see that there was also most of the interventions, kept the RT just around 1, but for almost all of them, the epidemic, the RT increased again after G when schools were reopened. And in this last graph, it shows the regression plots. It shows the regression line between the log per capita cumulative incidence and the log population size. Generally, there seems to be a linear relationship between the two, and the slope at each time point was greater than 0, which shows that, which implies that regions with higher population sizes had like higher cumulative case counts. And you can see that the trend was the same for the four time points in the plots. So in conclusion, seeing that the RT values around 1 in most regions during most months in Ghana showed that most of the interventions that were implemented were effective in slowing down transmission. But with the reopening of schools in January, there was a growth in the interventions. And lastly, I would like to thank Ms. Zini and Ms. Aubrey for sharing their codes for the analysis. Thank you.